Associate Dean for Education. Dean Sullivan is the intellectual architect of this event and is co-editor of the Teaching Public Health Volumes 1 and 2. Lisa, over to you.
Thank you, Dean Stein. It is truly a pleasure to be part of this webinar to highlight 3 more of our chapter authors from Teaching Public Health Volume 2. The second volume builds on the first, which was published in 2019, adding topics that are now relevant, having learned from the past 6 years and months of change in higher education and social upheaval, and continuing to learn as the forces that shape teaching and learning, particularly in public health, evolve. In this session, we'll hear from our esteemed presenters on ways to ensure that public health education is accessible to all learners, and some strategies to adapt public health training, both in formal degree programs and in new, more fluid pathways over the life course, as challenges continue to mount while the need for a well-trained public health workforce continues to increase. I now have the pleasure to introduce today's speakers. First, we will hear from Emily Goldman. Emily Goldman is a psychiatric epidemiologist and clinical associate professor in the Department of Epidemiology at the Boston University School of Public Health. She also serves as the director of our online MPH program. Dr. Goldman's research focuses on the social determinants of common mental disorders, population mental health surveillance, and physical mental health comorbidity. She is also interested in the development of pedagogical approaches for teaching epidemiology and public health to diverse audiences. Then we will turn to Viviana Harigian. Dr. Harigian is currently serving as the Vice Chair for Education in the Department of Public Health Sciences at the University of Miami Miller School of Medicine. She is also the Executive Director of the Florida Node Alliance of the National Drug Abuse Treatment Clinical Trials Network, housed at the University of Miami. Dr. Harigian's career has been committed to improving practice through the implementation of clinical trials in real-world settings and in creating the local capacities that would allow the implementation of such trials. Third, we will hear from Laura Magana. Dr. Magana is a globally recognized academic public health leader known for her commitment to transformation, innovation, and social justice. She was appointed the President and Chief Executive Officer of the Association of Schools and Programs of Public Health, ASPPH, in August of 2017. Before joining ASPPH, Dr. Magana spent over 35 years transforming public and private universities in Mexico and leading educational, multilateral, and nonprofit organizations across the United States, Central America, and Europe. Most recently, she served as the Dean of the School of Public Health at the National Institute of Public Health in Mexico. As a reminder to our audience, following the 3 presentations, we will turn to a moderated group discussion. We'll have about 20 minutes left in the program where we'll turn to audience questions. Please submit your questions using the Zoom's Q&A function and not the chat. The Q&A function is located at the bottom of your screen. Dr. Goldman, I will now turn things over to you.
Thank you so much. I'm going to quickly share my screen. One moment. Slideshow should be on. Can everybody see my screen okay?
We can see it, but it's not in presenter mode.
Got it. Thank you. Sorry, I'm just having a slow time of this here today.
It's quite
we just tested this too, so I apologize. Just struggling to get it in there. Please forgive me. Okay, I think we should be set now. I'm sorry about that. Thank you all so much, and thank you, Dr. Stein and Dr. Sullivan, for having me here today. I'm so thrilled to have been part of the Teaching Public Health Volume 2, as well as being part of this amazing panel today. So today I'm going to talk about promoting accessibility through the life course of the learner. So what I'd like to do is just start by talking about why we should promote access to public health education. It seems very obvious, I'm sure, to everybody on the call, but I always love to just make a case for why we want to think about this. So if the goal of public health is to promote equity and health equity by addressing health disparities, one of the key ways that we can get there is by creating knowledgeable communities and diverse and prepared workforce, public health workforce. And I think this was particularly apparent during the COVID-19 pandemic, and then continues to be now in our current political environment. So how do we then do this? And then increasing access to public health education seems to be a key strategy for creating these knowledgeable communities, that's diverse, prepared public health workforce. So today I want to talk about 4 particular mechanisms for promoting accessibility across the life course of the learner. Now, these are not all of the places where there are these sort of access points, but I wanted to sort of highlight key areas. The first is early exposure in middle and high school. Let's go even earlier to starting to talk about public health and promoting accessibility to public health education to even younger students. The next area is expanding undergraduate offerings, followed by reducing barriers to public health graduate education, and finally, increasing lifelong learning opportunities. What I'd like to do today is go through each of these 4, what I sort of call access points, to discuss why we might promote accessibility there, what some of our current challenges are, and then some potential solutions, and then I'll wrap up with some future directions. So starting with early exposure in public health, and just to step back for a second, I want to make one last comment that promoting accessibility at each of these stages, especially at the earlier stages, can really serve to have a snowball effect, whereby increasing exposure to public health earlier just sparks lifelong learning in public health. So these aren't really these distinct areas, but rather a place to really get the ball rolling. So starting with early exposure to public health. So public health education can really help students in this time of their lives build health literacy and some of those critical and problem-solving skills that are so important and are built in other coursework, but can also be built through public health education. It can also equip students not only to interpret and understand health information, but help to counter misinformation, which I think is particularly important in the current context as well. And then finally, this is an opportunity to early on spark lifelong interest in a public health career. This is time where kids are thinking about what they might want to be when they're older and thinking about what they might want to study. And sparking interest in public health this is a great opportunity to expose students at this time in their lives to public health and its function. However, there are challenges. This is something that people have started to do, but there are remaining challenges. There's limited curriculum space. Some of curriculum in middle and high school is really structured. It's hard to find a place to build in public health curricula. Instructors also need expertise in these areas, and this may not be something that is a part of training for all different types of teachers having experience with public health education. And then, of course, there are funding and time constraints in terms of building that curricula. So what can we do to increase accessibility in this context? One is to provide free teaching resources and flexible frameworks for middle and high school teachers. The CDC offers some of these, and there are some other published articles that talk through frameworks in teaching things like epidemiology and global health in this context. The idea is to help create that curricula and take some of that time and cost out of doing so. Additionally, we can continue to expand and strengthen pipeline or pathway programs. So there are already some great programs that target middle school, mostly high school students, to introduce them to public health concepts. They may spend a summer doing some coursework at a public health school or through public health classes, but really trying to expand some of those pipeline or pathway programs. And through particularly targeted outreach. So as I said, these exist, but they may not be as accessible to, say, certain underserved communities. And what we want to make sure is that we're including students who may be first-generation college, middle school, and high school students, students in communities that are historically underserved or underrepresented in public health, and making sure we're targeting that outreach to encourage participation and also provide some financial support for doing so. Then we move on to undergraduate public health education. So there's been a rapid growth in undergraduate public health education over the years. I believe it's a 12% increase in bachelor's level conferrals in public health over the past 30 years. So we've seen great growth in the availability of these programs, but there still remains some disparities. For instance, one article by Karen et al. In Frontiers of Public Health a couple years ago noted that in four-year schools, undergraduate schools, about 84% of them offer a degree or a course, even just a course in public health. And this is compared to about 26% at historically Black colleges and universities, or HBCUs, and 30% at community colleges. So you can see the availability of degrees and coursework in public health is unequal. So some solutions here is that we can add public health to general health requirements, both in 2- and 4-year colleges, to make it part of the general education program. Secondly, we can promote and strengthen those ties to 4+1 or 3+2 Master of Public Health programs. So this would save some time and some cost for public health, undergraduate public health education, and get students involved in public health education earlier. Also to expand community college offerings, so bringing in community members and public health practitioners, instructors from other universities to expand, to make sure that community colleges have this offering. And there's a very cool project that's happening in community colleges and public health to increase these offerings. Additionally, students in community colleges may go on to 4-year institutions, and making sure you have these agreements between these universities so that the coursework counts. Those courses count towards the 4-year education would be really important and would be a real drive to build some of that public health education. And then finally, similarly, to build and strengthen pipeline and pathway programs from undergraduate programs as well, and really thinking about some of those programs being targeted towards institutions that don't have public health degrees or courseworks like we talked about. Additionally, and just something fun I wanted to add, another way we're trying to increase accessibility and awareness of public health education here at BUSBH and our epidemiology department, we're starting to run these hackathons for health equity in with undergraduate students, trying to get them interested in public health. Moving on to graduate and postgraduate education, obviously there are prohibitive costs and limited scholarships. We need to strengthen those financial supports, childcare supports, caregiving support, and having flexible programs so students have availability. Additionally, accessibly priced online programs could really help in this regard. Students, once you're in the classroom, students have different backgrounds and learning styles. So making sure that you're assessing students pre-class to know how to meet them where they are, as well as using frameworks like Universal Design for Learning to make sure that your teaching and learning is inclusive. There's also some barriers to experiential learning, so outside the classroom in terms of paid opportunities. We can work to build stronger practice offices or strengthen them further. Faculty mentoring networks, scholarships, and cost-sharing relationships between organizations and institutions so that students can be provided with paid opportunities. And then finally, and my panelists are going to talk, my fellow panelists are going to talk about this much more, or is this responsibility and opportunity to provide continuing education, both to current practitioners and community members. And some ideas are online certificate programs, online alumni outreach, and partnerships in settings without established programs. And we'll hear more about this, I think, and I'm sure, for the rest of the time here. Just to finish up with future directions, we need to really continue to evaluate this. So to understand where there may be barriers and facilitators to public health education, to further promote accessibility, we need to know where they are. So we need to continue to evaluate them, monitor our programs and our course enrollment to identify groups who may be underrepresented or are facing additional barriers. evaluating pedagogic strategies that actually promote accessibility, and then implement and scale evidence-based approaches. So I think that there's a really wonderful opportunity for some schooling, so for some additional work in the Scholarship of Teaching and Learning here. That's all for today. I just wanted to thank you for your attention. I'm looking forward to engaging with you more on this topic, and here's my information if you'd like to reach out. Thank you.
Thank you. I'm trying to get my camera going. There we go. Thank you, Emily. That was fantastic. Thank you so much. Sorry, my screen was frozen there for a moment. And now it is my pleasure to turn things over to Dr. Harijian.
So good afternoon, and thank you so very much, Doctors Stein and Sullivan, for inviting me to present today. It's truly an honor to be part of this panel and to have contributed a chapter to the book. My name is Viviana Origian, and a little bit about my background. I was trained as a psychiatrist in Buenos Aires, Argentina, and I'm the granddaughter of 4 Armenian genocide survivors and an immigrant in the United States. And I say this because these experiences shape my perspective. So expect intensity, survivorship, and provocation in my presentation. So I want to start with a quote from Paulo Freire. He really shaped pretty much my teaching philosophy, that states that teaching demands a critical reflection of its practice. So if we want to engage in thinking about how do we keep current and relevant, we need to start thinking about how do we practice public health teaching. And we really recognize that current public health challenges are several and can anticipate probably future ones in an interconnected world. This includes the collision of epidemics, that's endemics, the social and structural determinants and commercial determinants of health that can synergistically determine health outcomes, and the threats of climate change. I used an AI image generator to represent these immediate challenges, but some really remain unknown. And this leads me to a real key point of my presentation, which is that we really need to train students that to a very adaptable environment. And our students would have to be ready for really jobs that have not yet been created, technologies that probably have not yet been invented, and problems that had yet not been anticipated. And this is not my quote, but a part of the Future of Educational Skills from OEDC 2030. So how do we do this? Is really we have to shift from a static approach to public health teaching to a dynamic approach to public health training, which is really fostering a culture of critical thinking, innovation, and collaboration that goes across borders and disciplines, that is intersectoral, cross-sectoral, interprofessional, while at the same time we embrace continuous learning and adaptation. This will require us to integrate really current real-world scenarios, practice-based teaching, project-based learning, emerging technologies, and definitely data-driven decision-making. Our goal will have to be developing a dynamic and adaptable public health workforce that is prepared for lifelong learning and self-discovery, and that it's empowered to think critically, analyze complex information, and make informed decisions in the face of uncertainty. Now, to do this, to fully embrace the fast pace of change, our core courses and our curriculum must be living documents, not monuments. I think that the second important shift that we should embrace in public health education is moving from aspirational to intentional. And this is this exemplar approach is embodied by the Framing the Future 2030 initiative, which is a visionary, intentional, multi-pronged, and multi-level roadmap that's aimed at preparing future public health professionals for a world of complex health challenges. If you have not had the chance to read this phenomenal reports, and that an image of the 3 reports are here, focused on inclusive excellence, transformative educational models, and building and fostering community partnerships to expand reach. I really invite you to do so, because there's many guiding questions that can help any program or school chart a map forward, and being really intentional about it. So I want to now focus on lifelong learning. I know that Emily made a reference to this, but this is the really continuous, collaborative, self-directed, and active approach to learning across various domains. But what's important is that this becomes sustained throughout life, and that this I see as an essential approach for public health professionals. Now, the challenge for public health education is really to nurture early on the development of skills and traits that are required in engaging in lifelong learning. This will really require redirecting the investment in learning from one that's focused on outcomes, grades, and other, to one that's process on focus, and it's that it's process driven. Our approach should also be fostering, rewarding motivation, curiosity, creativity. We should be promoting reflectiveness and self-awareness. We should be nurturing the willingness to bounce back from mistakes, help students make mistakes, but learn from themselves and others. And important to this approach is also being able to exercise flexibility in thinking, and metacognition, which is really to think about how you're thinking. And I think that we can only do this if we embrace a cycle that goes from learning to applying to adapting to unlearning and relearning. I wanted to share with you a framework, which is more a holistic approach on human development that was conceptualized by Frank and other faculty of the University of Miami and beyond, which is really embracing lifelong learning, but it's called Education for Life. And this is a lifelong journey of acquiring knowledge, skills, and attitudes that are going to be necessary to navigate life's complexity, thrive in all aspects of life, and contribute meaningfully to society. This was part of a conceptual model developed in envisioning what's the future of health professions education. So there's 3 areas, and I'm bringing down these areas to public health education. So learning throughout life, I covered it through lifelong learning, and this will require really critical thinking and curiosity. The second point is learning to live life, to give life. And this is our commitment to promoting and restoring healthy communities. So our goal here for public health is going and moving beyond the understanding of the social determinants of health and all determinants of health to one that it's a commitment to community engagement and a commitment to civic engagement. The third point of this holistic approach is learning to live our own lives. And this emphasizes the importance of self-knowledge, self-awareness, and self-discovery and personal development. And I cannot underscore how important this is in our profession. We have seen burnout and during the pandemic, and this is prevalent in all health professions, but this will require that we embrace an approach that invites individuals to self-reflection, to understanding their beliefs, their values, their strengths, their weaknesses, and they chart a road for their own human development. The next shift is really moving from our foundational competencies to integrative competencies. So in this ladder, you see as the first ladder, the C foundational competencies. So this can no longer be the ceiling for us, or accreditation being really the destination, but really our launch pad. And what I would like to advocate is that we embrace competencies that go beyond these foundational competencies, that are integrative, that cut across. And this include systems thinking for an interconnected world, the development of emotional intelligence, creativity, and teamwork. So this can only happen through inquiry-based learning, role-playing exercises, and interdisciplinary approaches. So we can discuss probably in the moderated panels in which ways we can address this, but I want to make sure that we think on other competencies. So like the ability of developing an inspiring capacity of visioning, of creating, of navigating uncertainty, of building trust, of taking risks, and definitely being AI competent. We can talk about how can we do this, and what are the things that we can incorporate in our classrooms to start navigating this shift from foundational to integrative competencies. So there's several ways in which we can cultivate emotional intelligence, and I want to underscore how important this is, particularly also in this third domain that I shared with you on learning to live our own lives. And we can teach fundamentals, we can embed self-reflection and help students through journaling, self-assessment, mindfulness to develop self-awareness. We can promote experiential learning in multiple ways, develop and model really interpersonal skills by demonstrating empathy and giving constructive feedback, foster cultural humility, creating inclusive classrooms. But what's most important is really that we assess this growth, that we assess and evaluate self-regulation and interpersonal skills in assignments and feedback, and that we support this emotional intelligence development over time. So this is across these 5 domains, which are self-awareness, self-regulation, motivation, empathy, and social skills. These are going to be critical for our students in the future. I think Emily did a phenomenal point on the importance on how technology and innovation has helped us or will be critical in creating access and expanding access. And it has helped us in so many ways. There's no doubt that these are going to be important, and there might be technologies that we don't know of today. And they have helped us disseminate information, enhance the learning experience, expand access, has supported collaborative learning. In the past, I would say, year, we have been talking about if we should integrate AI. That's not never an if anymore. There's multiple ways in which we can integrate artificial intelligence in our teaching. The question from to deliver content, to enhance and optimize the learning environment, the challenge probably will be on making sure that we understand what's the framework that's guiding the technology and the innovation integration in our classrooms, and most importantly, the ethical considerations around it. And I would like to finish with one progressive approach probably to training, which is the importance of collaborative approaches, which really enhances and emphasizes the importance of interactive learning. This is collaboration between students, educators, and practitioners, while at the same time putting the learner and integrating that individualized student experience and need as part of the approach. So this really covers 2 aspects: the learner-centered education, which is how do we meet the needs, the unique needs, interests, and goals of each learners, but really empowers them to provide input on what they want to see as the offerings, and it requires a shift where we can see educators as facilitators, guiding students in their learning. And this will probably require us to move from a culture that promotes hierarchy to one that's a pedagogy of vulnerability and a stance of humility. And the second important point on collaborative approaches to teaching is really how do we invite partners, the ones that we know today and those that we might know and discover in the future. But today, definitely academia, government, and industry, and not only in the offering of practical experiences, but really on co-curricular and on co-construction of the curriculum. So this will be a win-win for both the academic institution and for industry and government. So I want to close with another quote, which intends to be provocative, but also offers some hope, that from Paulo Freire, Pedagogy of Freedom, that states that teaching demands a conviction that change is possible, and I believe it is. With that, I would like to thank you and turn it back to you, Lisa.
Thank you. That was excellent. Thank you so much. Very inspiring. And so now I would like to turn things over to Dr. Magana. Viviana, can you stop sharing maybe? I think we might need that first. Okay, I think it's coming up now. Okay, we see it. Dr. Magana, you are on mute still. Wait, still cannot hear.
Can you hear me now?
Yes, got it.
Oh, perfect. Perfect. Thank you so much. So good afternoon, everyone. It's really a privilege to be with you today and an honor to join the BU Teaching Public Health Conversations once again. And I have already enjoyed so much the two presentations. Thank you, my colleagues, for being so brilliant in your presentations. And thank you for really talking about the foundation of something that I'm going to be concentrating, which is lifelong learning. So today, I really want to issue a call to action after just hearing my two dear colleagues, but also my own presentation. A call for a fundamental shift in how we approach public health education. We must move beyond outdated, one-time models of learning and embrace lifelong learning as a structural, unwavering commitment, as my previous presenters talk about it. Because the challenges we face, pandemics, climate change, misinformation, technological disruption, are not one-time events. They are constant, complex, and evolving. To meet them, we need a public health workforce that is prepared, not just for one job, but for a lifetime of leadership, adaptation, and impact. This moment, our goal is bold: to shape a public health workforce that is not only skilled, but also resilient, agile, and future-ready. In a world of accelerating change, lifelong learning is no longer optional. It is essential. It empowers professionals to stay sharp, stay relevant, stay energized across decades of service. It transforms education from a one-time phase into a continuous journey of growth. And we already talked about that even public health education is going to start in higher education and even earlier than that, hopefully earlier than that, like K to 12, right? So it transforms education from a one-time to now the life continuous journey. So this mindset aligns with the digital age, where knowledge is abundant, careers are non-linear, and our greatest asset is the ability to learn, unlearn, and relearn. But before we build forward, we must confront a sobering reality. The World Health Organization warns of a shortage of 10 million health workers by 2030, especially in low and middle income countries. COVID-19 exposed the cracks in our systems: burnout, politicization, and insufficient support. We lost far too many public health professionals. If we don't act with urgency, the erosion will continue, and our ability to respond to the next crisis will be even weaker. We must not only rebuild our workforce, but we must reimagine it. This moment demands a cultural shift. The learners of today will navigate careers we can't yet name. Static education will not prepare them for a dynamic world. We must build educational environments that are flexible in design, experiential in practice, and personalized to each learner's life stage and pathway. This is not a tweak to our systems. It is a real transformation. According to the Future Skills Report, higher education must be guided by 4 key shifts: personalized learning, tailored to the learner's strengths, needs, and aspirations; future-focused skills, prioritizing adaptability, empathy, and systems thinking; multi-institutional pathways, building bridges between academia, employers, and sectors; lifelong access, offering learning not just in youth, but across the entire lifespan. They are not just trends. They are the new pillars of the 21st century public health education. So to make this vision real, we need a new social contract between institutions and learners. Gone are the days when a degree was meant to last a lifetime. Today, we must commit to flexible, stackable, and accessible pathways, as my colleagues have mentioned, recognizing informal and prior learning, designing curricula in deep collaboration with the workforce, and supporting learners at every stage of life. And above all, this must be built on a foundation of equity, inclusion, and solidarity. This isn't just education reform, it's really a social justice in action. Consider the idea of the 60-year curriculum, a bold reframe of lifelong learning. People are living and working longer. Careers span decades. Roles evolve constantly. Instead of front-loading education in our 20s, we need a system that sustains learning through a lifetime. In public health, this is critical. We must keep pace with new diseases, new data, new technologies, new socio-political demands. Lifelong learning isn't just nice to have, it's the only way we remain prepared, purposeful, and powerful over time. To make lifelong learning work, we also need to rethink how we structure and access learning. The traditional credit hour model is really a poor fit for people who learn on the job, pursue micro-credentials, or return to school mid-career. Instead, competency-based learning allows people to progress based on what they can do, not how much time they will be sitting on a class. Combined with learner-centered methodologies, as my colleagues have referred to, this approach empowers people to take ownership of their learning, work at their own pace, and focus on skills they need now. In public health, this might mean mastering outbreak responses, data visualizations, or health equity principles exactly when those skills are needed the most. This transformation redefines the role of faculty. Educators are no longer just transmitters of content. They are mentors, they are designers, they are facilitators, lifelong learning coaches. Faculty must be supported to teach across platforms, meet learners where they are, and continually hone their craft. They are the heartbeat of this shift and the architects of this success. And the good news, that this revolution is already underway in many schools and programs of public health. I will just mention here on the screen a few examples of the type of initiatives our community is undertaking. But already we're seeing in our community institutions that are offering micro-credentials and rapid upskilling, that are leading workforce development with really a very practitioner focus. They are already tailoring online programs. But these are not just pilots. These are models that we need to learn, to scale, and to replicate. So let me end where I began, with urgency and hope. Lifelong learning is not a buzzword. It is an imperative for the future of public health. It requires courage to rethink, redesign, and recommit. If we rise to this challenge, we will strengthen our workforce, empower our communities, and build a more resilient, healthier world together. Now is the time. We need to lead this transformation. So thank you. I'm grateful for your partnership, and I look forward to continuing our journey ahead together, building the educational system our communities deserve. Thank you, and well into the discussion right now. Thank you.
Thank you so much, Dr. Magana, and all of the speakers. Those were excellent presentations. And what we will do now is turn to a moderated discussion. As a reminder to our audience, please enter any questions that you might have into the Q&A, and we will try to get to as many as we possibly can. And let me kick it off a little bit. I wrote it down, faculty are the heartbeat of this shift, because as all of you were talking, I was feeling so hopeful about all of the things that you are describing. You know, we want to make education accessible. We want faculty to take care of themselves, their students, their communities, and we want to make these changes. How do we support faculty in this? And I'm thinking of that both individually. I think, Viviana, you talked a little bit about that. But I wonder from an institutional perspective or as a field, how do we support our faculty? I think we all may believe that teaching public health is a little different than teaching in other areas. And what might our institutions in public health do differently to support our faculty?
If I may start, I think, first of all, recognizing the importance of faculty in the whole transformation, because sometimes it's very easy for us to talk about the new competencies, the structural changes, the new scholarship for students, and all of that is great, and we need all of that. But if we don't change, if we don't support our faculty, if we don't recognize that the faculty is in the center of all this change, then anything that we do, it will be just, you know, a lack of really vision or strategy about what we can do. We can transform the structure, we can open more things, but at the center, faculty has to be, you know, taking into account that we need to pay attention to support our faculty, to train our faculty, to give them time to change and to transform and to study and to really take good care of themselves. And this is key to the success of any transformation. So I just want to say that should be really front and center of any transformation that we envision.
Thank you. Others?
Yeah, so it's you started from the most important point, right? Is, you know, recognize, reward, validate. We cannot move without that. I do know for a fact that the University of Miami has an entire initiative focused on mindfulness and mindfulness practices that cut across the different, that bring together different schools, and there's, a calendar of events. But I think that beyond the institutional offering, how do you create spaces where you can allow reflection, right? Because, and how do we shift to that approach as administrators in health education, where you where you nurture the opportunity to reflect on our own practice, as I started, and I think that can move forward. Some institutions are doing work on this, particularly if we are at the Miller School of Medicine, so there's an important focus on how to support well-being of faculty through different initiatives. But I don't know if your point was really going to that this doesn't only limit to chairs of departments or program directors or deans of schools. This has to be cutting across all levels. It goes, to the school, to the culture of probably the institution. So it's not just at a unit level. It's embracing a different culture of how to see this holistic human development. And I think that as part of it, and I referenced it in terms of students only, but it's also moving to from outcomes, how much, and in a school that is clinically focused and research focused is quite focused on how much you produce, but also how do we help you to grow in your own life. And I think that is important. The commitment is important across all levels of the institution.
Yeah, and I would just add there, and staff. We have so many staff
Absolutely.
involved in our educational programs, and we could not run them without our fantastic staff. So I didn't mean to omit them from the question. Sorry, Emily.
No, not at all. These are amazing points that my panelists are speaking. Just to add something, a tiny extra bit is just thinking about lifelong learning of the faculty member and parts of the training. So really prioritizing training in public health education in doctoral training. Some programs do more than that than others. And I think that that's not just about how to teach and pedagogic approaches, but, different ways to engage and make education accessible to students, but also really understanding the public health education system and the competencies themselves and why we're teaching what we're teaching and what students are going to be doing and what they need training on, not just what you needed training on to do what you're doing. So in your own doctoral or even master's level training for those thinking about faculty level positions, and then this lifelong learning, I think about this all the time, this wish for continuing public health education credits or whatever the equivalent would be to CME, and almost wanting someone to require it. I hope people don't get mad at me for saying that, but just to stay current. It's so hard. It's so easy to prioritize every single thing you have to do. But I think to stay current, to understand what the needs are for students is essential. So that continuing lifelong learning, just as my panelists were talking about, so important for faculty as well. Thanks.
Thank you. And just on that point, as we aim to make public health education more accessible, how and what strategies might we use to support non-traditional students that have never been in the public health education system, who we invite in? How do we support them?
I can start. One of the things that I think the Q&A discussions that we're taking, at least in the ASPPH, in terms of what is next, what we should be doing better and for the future. And one of the things that we're talking a lot is that we need new messengers and new messages, meaning that we have been a very traditional field in terms of how we talk about public health and who do we involve in public health. And we should continue doing that because that's needed. But how about the new people that we need to be talking in the community, like the churches or the coaches of the training coaches, or maybe the media, the influencers, and what are the other messengers that could be really talking about public health. So students, even before, like Emily was talking about, when they're in the high school or even in primary, they know they start talking about public health. So what are the other non-traditional audience that we need to be engaged in sending the message? So then hopefully all these communities are also going to be knowing about public health way, before they are actually starting to think about career. So that's just one way of talking about what are the new things that we need to be doing moving forward.
Great. Others want to add anything there?
I might just say that for students coming from different backgrounds, non-traditional public health backgrounds, I think there's a great opportunity to really understand what drove them to public health, what's important to them. I mean, I think really making it relevant is one of the key aspects of accessibility, so that when you're providing that training, you're incorporating examples and opportunities that are really engaging and feel authentic to the learner. And then additionally, I think really breaking down public health, I really think of it as a professional skill-based degree, not just about what public health does, but what are the skills that you will get and how are they linked to the skills that you have foundation for? I think that that's nice to see that connection, but also to make students feel more confident that they have these skills to succeed. These are just continuations of skills you have great foundation for, just thinking about it from a different perspective. So I think really highlighting those skills and making it relevant can be helpful.
Great.
Yeah, so I love that you brought, both of you brought to the point of, the new messengers and the new messages and the role of, of community. So so probably we have to broaden our concept of community, but this can only happen if we're close to the ground and if we are active listening. Where, so that the change on the messages, I am saying this particularly because of the messages. We need to be able to train our students to in active listening, but we also need to actively listen to really discover who are the other individuals that should be engaged, that can be engaged, that want to be engaged, and for whom it's relevant to be engaged.
Excellent. There is a question that's related to this thread. How do we involve industries and communities in the development of programs that stand the test of time and that we might be able to adapt to the changing landscapes? And if the questioner doesn't mind, I might add to that. And what might those industries be? Are there industries that we haven't yet intersected with that we should?
Yeah, so I think the issue of the test of time, right? Right now we know which are our industries, but again, it's like if we are very narrow in our approach to what we define as our collaborators or our sectors or our the disciplines that are in our field, we will not be able to do this. But to address the test of time, I want to highlight again that this cannot be one time and that's it. And a static approach will not make it. So engaging all stakeholders and maybe asking your stakeholders to help you identify additional stakeholders. Maybe we don't know who they are. And this will change. Probably it will change. But so the point is not embracing any of this in a very rigid and static approach, rather in a very flexible approach of discovering, like, it might be different and remaining open to learn. Who else needs to be brought to the table? Who didn't we know about? And that cannot happen in the walls of the institution. That has to be outside of our walls.
Great. Excellent point. Others? Well, there, oh, go ahead, please.
No, I just want to add that since the very beginning, I mean, we cannot develop curriculum competencies on the university. We need to have on the table and in the community, people from the community, the employers. And when I say employers, it's everyone. All the sectors have to be represented, not just the governmental public health, but also, the private sector, the for-profit sector. We need to know that our students now more than ever, they're actually working in a non-governmental setting, but it's more in the industry, more in the for-profit area. And when are we talking to them in terms of what do they need? And our graduates are working more with them. So we have to engage them since the very beginning, and we have to really make an effort to have a strong relationship with all the sectors that are currently and in the future. And this has to be evolving. We need to really always keep on an eye. What are the new industries? What are the new areas? What are the new jobs? And just bringing them to our educational setting or just to the platforms in order to really have that conversation is key for the success of our programs.
Excellent. Emily, did you want to add anything?
Just as a final point, and I absolutely agree, and even thinking about non-adjacent fields, anything where our students can use their skills in places they didn't think that they could use them. And I'm actually looking at, if I may call out the first Q&A question about jobs in this current context, but just thinking about the ways you can apply skills in different places. But any industry or organization that has anything to do with health or social determinants of health, these are the people we need to hear from, and bringing them in potentially to talk about how concepts or methods are applied in that context would be incredibly useful for students.
Yeah, thank you for connecting that question. It was related. You sort of answered it on the fly. Dr. Dean Stein, do we have time for one more question before you jump in?
One more for you, Lisa.
One more. Okay. So I just wanted to link back to the ASPPH Framing the Future 2030. Viviana shared it, and this was Dr. Magana's initiative. Many of us had the privilege to be part of it. And it was a call to action. And I wonder if I could ask each of you to give us one thing that we should be trying to do related to your presentation. If you were to, you have the platform to call us to action. What are you calling us to do? Emily looks in deep thought, so maybe we'll go in reverse order. Okay. Dr. Magana, can we start with you?
Well, maybe emphasizing my presentation with one statement that when we think about education, when we think about public health education, we shouldn't think anymore of graduate program, just one time, 2 years, 1 year. We have to think about the whole lifespan, all the way, as Emily was saying, from high school or even before that, until retirement. That's our student is there all the way of lifelong. So we need to really transform our institutions, our structures, in order to allow for education to happen everywhere along the lifespan.
Thank you.
Yes, and I think that this brings me, if there's one thing is on the stance of, that teaching really demands to think, education as something that's unfinished. It's an unfinishedness of it. But from there's the reports are so phenomenal. But I think that one of the things that it's most relevant, or one thing, as you asked us, is I think the way we embrace community and bring partners into to the table is not just only on to make sure that this become our future employers, but in the curricular design. So I think that this is something, and broaden our view of partners in a way that's more strategic. So there's every single report has so many gems that it's very difficult to focus on one. But
last word to Emily.
Oh my goodness, no pressure. I would just say that, particularly in this context, the way we communicate what public health is and what we do and what you could do and how you could make public health part of your life and your career is really important to get people excited, but also to meet people where they are, as well as community members who could be involved as well. So I'll leave it at that, but thank you.
Great place to leave it. Thank you. Super inspiring conversation. Thanks to everyone for joining in the discussion. Thanks you to Dean Sullivan for leading us, and to our speakers. Special thanks to you, our audience. And we hope you'll join us this fall for upcoming programs, which you can learn more about and register by visiting www.publichealthconversation.org. Thank you, and have a